Hello everyone, welcome to Langfort International Academy. This is Richard Caroline.
And I'm Akrina.
So we are back with another role play for you. So we have picked one of the exam module cards and I'll play the part of the nurse and Akrina will be handling the part of the patient. So we will see what type of card it is while we are doing the role play and then we'll straight away get into the discussion of it.
Langfort International Academy. Your passport to the world of opportunities.
So you have your cue card and you have 3 minutes to prepare.
May I know the name of the patient, please?
You can call me Georgina.
Alright.
So your time starts now.
Good morning, Ms. Georgina.
Good morning.
How are you feeling now?
Well, actually, I'm feeling okay right now.
So I'm really pleased to hear that you're feeling much better than earlier. So I'm here to monitor your bladder function. So before we get into any further discussion, I would like to ask you some questions. Is that okay?
Yes.
So do you experience any pain?
Yes, I do have a bit of pain in my abdomen. However, it is manageable.
Alright, and did you pass urine?
No, I haven't passed urine yet.
Alright, okay. So Ms. Georgina, you mentioned that you're experiencing slight pain. So I would like to discuss it further. Can you tell me when exactly it started?
Well, the pain started, not long after the catheter was removed. However, as I mentioned, it is not that bad.
I understand. And I infer from what you told me that since it was not that bad, you might not have tried any treatment or taken any medicine for that. Am I right?
Yes, that's right.
Okay. So moving on to a couple of questions about your hydration, because we have had advised you to drink water. So can you tell me how many glasses of water you have had?
I drink 2 glasses of water an hour and the last one was half an hour ago.
So thank you so much for answering all the questions. So from what you told me, I understand that you have been experiencing slight pain, which is really manageable since the catheter was removed. And you did not try any treatment for that because it was highly manageable. And you have been drinking 2 glasses of water every hourly and the last drink you had was half an hour ago. Am I right?
Yes.
Okay, so Ms. Georgina, you do understand that we actually run a trial without catheter for you to see whether your bladder function was restored. And I'm sorry to say that it was unsuccessful because you didn't pass urine yet. So I would like to discuss what we will be doing next. So the next best thing we can do is to reinsert the catheter, and don't worry, you can go home with it and you will have a catheter bag along with that. And please keep in mind to come back after a week because we need to have a retrial as well. And I don't want you to worry about all these things. I understand it might be a little difficult for you to take all these things right now, but please set your mind at ease. We are all there to help you. So do you have any questions about the procedures?
Well, actually I was hoping I could go home now that the catheter has been removed, and I really don't want the catheter to be reinserted.
See, I totally understand where this is coming from, and I'm sorry to say that if we don't do this, there would be a lot of complications, and I would like to bring your attention to a couple of those as well. So you do understand that ever since your surgery, you have had trouble passing urine. So if you don't reinsert the catheter now, it can lead to urinary retention and it can cause urinary tract infections and many other complications. So Ms. Georgina, you really do not want to go through all those complications. The only thing you need to do right now is to go through the reinsertion of the catheter. So I hope you understand the importance of it.
Well, I can understand what you're trying to say. However, I really am not keen to go home wearing a catheter bag, and I'm not sure if I'd cope with emptying it as well.
Well, I understand you're quite in a distress thinking about the catheter management, but if it gives you any peace of mind, let me assure you that it is not going to be a tedious task. The catheter bag management and emptying of it will be really easy for you. And if you need, we can also arrange for an extra help from a community nurse too. So how does that sound?
Yes, that sounds pretty okay.
Alright. So with your permission, shall I proceed with the reinsertion?
In that case, yes, sure.
Alright, okay. So before we get into that, do you have any further concerns to be addressed?
Yes, I do have one more concern. So I would like to know, when will I have to come back to hospital?
That's a good question from your side. So as I mentioned a little earlier, we'll have to run another retrial a week later. So it is advisable for you to come back another week and assess your catheter as well as to run the retrial for you. However, if at all you feel any discomfort or if you experience any symptoms like pain or anything like that, feel free to contact us anytime and we will definitely help you with that. Okay, so I hope I have clarified everything for you. So the next thing we need to do is a reinsertion of the catheter. So since I have your permission, please wait here. I'll come back with the arrangements. Okay, in the meantime, if you need anything, please ring the buzzer. Thank you. Alright everyone, so that was the end of the role play. I hope it was helpful for you guys. Okay, and I'll come back with more videos like these. Please post your valuable feedbacks in the comment section and let us know if you want us to do any particular cue cards. If you have any topic in mind, let us know in the comment section. So we will see you guys next time. Until then, take care. Bye-bye.